It's in Malcolm's kitchen where this strike really hits home. How much pain is she in with the shoulder?
Crying pain. I mean, she sits there and cries with it, you know.
His wife, Maureen, needs treatment for fluid on the brain, but she also needs shoulder surgery. That operation was due to finally happen this month.
Unfortunately, she says, we're going to cancel. Yeah, I says, why? Because it's because of the strike. He says that the junior doctor says we've got no theatres and we've got no staff.
She spends much of the day in bed, and Malcolm just keeps topping up the painkillers, which are becoming less and less effective. The NHS hospitals in their part of Lincolnshire acknowledge this week will be difficult, but say critical services will keep running. It is the timing of this strike that makes it so disruptive, coming in right after the long Easter bank holiday weekend. And junior doctors are so often the ones who hold it all together when services are stretched. 4 days without them means senior colleagues, consultants and other NHS staff stepping in across England. The contingency plans here at West Middlesex Hospital in West London are fairly typical. It cannot be business as usual.
We'll be prioritising emergency surgery, we'll be prioritising cancer care, care for children, intensive care patients, but there will be patients who will have their care postponed, which will be very frustrating for patients up and down the country. And there will be a period where we will have to work exceptionally hard to try and meet that backlog of patients, which we know exists even at this point without the strike.
Like nurses and ambulance workers, junior doctors want better pay too. They say the service they provide is in crisis and that they've had 15 years of below-inflation pay increases. But the Health Secretary says their request for a 35% pay rise is unrealistic. With no breakthrough, the health service in England is once again asking for the public's help.
Our main message to the public this evening is use the NHS sensibly. If you've got a life-threatening emergency, ring 999, but otherwise make good use of your local pharmacy, your local general practitioner and the 111 online service, because our hospitals will be under significant amounts of pressure during the course of the rest of this week.
Until there's a settlement, patients and their carers will just muddle through, in pain and often alone. It's not the care anyone wants to provide. Tom Parmenter, Sky News, Lincolnshire.